guys, Dimitri from Total Physical Therapy, total-pt.com. Last time we talked about how poor posture affects the neck mobility that you have or don't have when you are slouching. So let's review this very quickly. When you're sitting in a slouch position, you can't really extend your neck. And if you correct appropriately based on the previous videos, you can now attain a whole lot more mobility, similar to having more mobility in the shoulder when you properly put yourself up in the proper position. What's more important here is to understand why you have that mobility. In previous videos we talked about how in the lower back we want to arch to maintain proper position of the disc, because when you arch your back you extend and as a result your disc moves forward. In your neck that is exactly the same concept. You have discs in between your vertebrae, and when you're sitting in a slouch position you are flexing the head forward, so that creates a posterior migration of that disc material that can create pins and needles or radiculopathy in the arms, neck pain, trap pain. So when you are sitting up straight, just like in the lower back, you arch your back. When you sit up straight, that little move in the neck is not just extension, it's actually that retraction followed by extension. So if everyone can try this at home, if you just arch your neck back, you're not going to go nearly as far as if you tuck and then go back. And that tucking is important for one reason. Your vertebrae sit on top of each other and they're connected by what's called facet joints. And what those joints are is they connect the top vertebrae to the bottom. So what occurs is when you bring your head forward, the top vertebrae slides forward on the bottom one. When you tuck back or slide back, you align the neck so you could then extend back. So if you stick your head out forward, you're already taking that facet joint and you're engaging it. And that doesn't allow you to have any more mobility elsewhere. But if you lock it in, you now have a lot of mobility in either direction, especially going back. So when you are in a slouch position, your head has to be forward because it can't keep itself in line. And then when you sit up tall, instead of the press up for the lower back in extension, in the neck what you do is you retract and then you tip back. And that allows that full mobility. The other impact that it has is when you're in a poor position, you compress what's called the suboccipital region, which is the region that is just underneath the cranium or the head. When I slouch, if you look at my finger, when I slouch, I squash everything back there. All right? And there's a lot of neural structures there, a lot of muscles there that are compressed. When I sit up tall and slide, it opens up that entire region here and allows that to open. And most folks who have chronic headaches are in this position all the time, typing away on their laptops, on their smartphones, in a crappy position. So by sitting up straight, align the facet joints by doing a chin slide. That opens up the suboccipital space, reduces headaches, and a lot of migraine issues stem from, again, suboccipital compression. But again, to get full mobility in your neck, slide first, lock the facet joints in place, align the neck, then go back. So now you have the press up with the lower back in terms of arching to prevent those discs from migrating posteriorly, affecting the spine. Same concept in the neck, two-step process. After sitting up straight, of course. Slide, then extend back. All right? And you can try that for yourself. Any questions? Give us a holler. Otherwise, we'll see you next time.